Great, thank you. Every human being is the author of own health or disease. Disease is a result of disobedience to the immutable laws of health that governs life. This is the passage of Gautam Buddha, and he's talking about the role of karma in health. Good morning, everyone. On behalf of ArdorComm Health and Wellness Community, an emerging community in healthcare sector, I, Chandan Anand, founder, CEO, and group editor of ArdorComm Media Group, welcome all our eminent speakers, special guests representing the healthcare fraternity today. I welcome all the delegates and attendees who have managed to block your time to be a part of this virtual forum. I welcome each and everyone in today's inaugural and unveiling of India's first and biggest new normal healthcare leadership summit and awards 2022, powered by Kenoff Sealing Solutions. This is a two-day virtual symposium. This is a beautiful day, and we are about to witness the august presence of our esteemed guest speakers, experts, and stalwarts of the healthcare and wellness community. And we also appreciate the participation of the attendees and viewers representing the healthcare community. We welcome our partners, powered by partners Kenoff Sealing Solutions, associate partner Accurex, university partners Shobhit University, Meerut, Uttar Pradesh, and DY Patil University, Ambi Campus, Pune. I also thank to all our 5 community partners: education community, human resource community, governance community, media, entertainment, and art, who supported our mission of spreading the ideas of socio-digital transformation and innovation. We feel privileged and glad to host this event. Let me invite your kind attention towards a small introduction of ArdorComm Media. ArdorComm Media Group is a growing media company enabling communities of education, HR, healthcare, wellness, governance, media, entertainment, and art, abbreviated as MEA, to effectively advance their business and strategic interest by becoming their collaboration catalyst. Our passion is to co-create, co-learn, and collaborate for innovation and socio-digital transformation. A short overview of how we started this media venture. When the overall industry was sailing across a VUCA phase of existence and survival, during the peak of second wave of COVID-19, where companies were in a cost-cutting situations or shutting down their operations, loss of jobs and uncertainty could be witnessed by many, our foundation team dared to start this media venture. We got incorporated just a couple of months back as a media startup with the name ArdorComm, where Ardor means passion, zeal, and Com stands for community and communication. Our 5 core values are aspiration, reimagination, digitalization, opportunity, and readiness, abbreviated as Ardor. We were able to extend employment opportunities to the deserving young candidates, having still have a strong working zeal and skill to work and outperform. With this effort, our journey started as a social entrepreneur. Our media team is passionate about putting an effort in co-creating positive changes in the society by inviting community leaders like you and co-create such knowledge-sharing platform. We aim to become India's leading and most desirable media voice by enriching community with the ecosystem of knowledge-sharing platform, information, and news. I strongly believe that health and education are 2 important fundamental rights of each individual, and we must look for the options and opportunities of how we can contribute for the betterment of this sector. Under the group umbrella, we have ArdorComm Healthcare and Wellness Community, which is empowering over 20,000 doctors, hospitals, clinics, healthcare marketeers, healthcare professionals, and service providers for socio-digital media adaptability for growth and outreach. We co-create educational wellness programs, workshops, master classes, and training sessions for improving physical, mental, and social well-being. So coming to the event part of it, the healthcare sector has transformed drastically and a lot over last few decades. India has made significant advancement in the way healthcare is delivered in the country. In terms of employment and revenue, it has one of the largest sectors and growing sectors at a brisk pace. There are vast opportunities of investment in healthcare infrastructure in both urban and rural India. Government initiatives, policies, and schemes are aiding the future vision of democratized distribution of digital health and improving economic growth. COVID-19 pandemic has accelerated the growth and the speed of innovation, research, and discoveries. From ignorance to basic hygiene, all Indians have come a long way. To discuss the socio-digital transformation in healthcare, ArdorComm Media is hosting India's first and biggest 2 days virtual symposium named as New Normal Healthcare Leadership Summit and Awards. It will act as a host and a platform where eminent personalities, thought leaders, and industry experts will e-meet to deliberate on the next and best practices, innovation, investment, opportunities, and roadblocks to the sector's progress. We have dedicated sections on healthcare leadership, CIOs, CTOs, wellness, AYUSH, abbreviated as Ayurveda, Unani, Siddha, yoga, and homeopathy, pharma, and medical colleges. We have a separate sessions for each of these segments so that the entire healthcare and wellness communities could be addressed in a proper way. Prestigious ArdorComm Healthcare Leadership Awards and Felicitation will recognize and honor those individuals, hospitals, and organizations who have demonstrated a significant contribution to the healthcare, wellness, pharma, AYUSH, health tech, and medical education. We got decent participation and nomination response for the ArdorComm Healthcare Awards 2022. The awardees' names will be declared live at the valedictory and award ceremony session tomorrow evening. So don't miss to be a part of it and attend it. So with us, we have two eminent personalities and our special guest for the day, Dr. Heera Lalji, IAS, Additional Mission Director, and Dr. Rajkamal Yadav ji, IAS, District Magistrate, Baghpat. To introduce first, I would like to have the honors to introduce Dr. Heera Lalji, the IAS and Additional Mission Director, NHM, Government of UP. He also is the Director of UP State for AIDS Control Society, Lucknow, Government of UP. He acquired BTech in Electrical Engineering from GB Pant University of Agriculture and Technology, Pantnagar. He completed PhD in the role of ICT in achieving good governance with the reference of UP through a study of select governance programs from Dr. APJ Abdul Kalam Technical University, Lucknow. His duration of research from 2015 to 2019. He started his career as an engineer in NTPC in March 1993. Dr. Lal has served in many positions of Government of UP like MD, UP Small Industry Corporation, Special Secretary, Cultural and Directorial Culture, Managing Director, UP DESCO, Special Secretary, Rural Development, Regional Food Controller, Faizabad Division, Special Secretary, Labor, and Special Secretary, Home Guard. He was DM Banda for 1.5 years. He received many awards in his innovative work and out-of-the-box style of working. He's having an outstanding record for successfully running administration in different positions and locations using IT-enabled services for providing good governance to public and many more. I am really honored, Heera Lal sir, to introduce you. And with these small words of introduction, I would please like to invite you for your opening remarks for the day. Heera
Thank
Lal.
you. Thank you for inviting me and giving this opportunity to be here in this webinar, to be part of this amazing event. And I welcome all the participants who are present over here. So we are talking about the healthcare. We are talking about the healthcare. What is the quality healthcare criteria that we have to decide? Because to acquire that criteria, we do everything. So in my opinion, affordability is one criteria, easy to use second criteria, and timely treatment, timely getting the medicines or treatment is the third criteria, and accessibility to that service is the fourth criteria. So this is the basic points around which our healthcare services are roaming. So in offline health services, all these criteria are difficult to meet together. That's why we are slowly moving from offline to online. In online, all these criteria we can provide together in tandem to get the efficient, cost effective, and sharing of right information is also required. Otherwise, we will not get the right medicine for the our ailments. So this is the basic need. That's why we are switching over from offline to online. So I think we should go question answer format. I hope so.
Yeah, yeah, yeah. So, understanding your good governance as when you are in the role of Sir District Magistrate of Banda, what special initiatives did you take over there so that it could be replicated for many of them who is witnessing you in that model, sir?
Actually, how to mobilize the healthcare sector persons, stakeholders, that is a big challenge. Their capacity is not up to the mark. How to do the capacity building, how to motivate them, and moreover, how to make them healthy and wealthy, because the healthcare providers are having many type of illness. If they are not well, how they can think to provide the wellness to the others? So I started yoga my bada in district, and I started yoga in the morning in the hospitals first, so that the service providers should get this habit in their life. So if that will be a habit, automatically they will provide that services to their clients. So that way, and for the capacity building, we use to emphasize on the training frequently by the experts, offline as well as online. And slowly, we saw improvement in the quality of the services. So that was a very simple way to improve the healthcare services in the district and in remote area. Generally, we do not focus on the training and capacity building if our workforce is not capable and their capacity not up to the mark. How they can do that their job efficiently and they can give us the impact required.
Right, sir. Under your leadership, sir, when you are as a National Health Mission second in command in hierarchy, any special reforms or programs which is running under NHM which you would like to highlight over here?
Actually, now NHM, not only NHM, whole country is shifting from online to offline. For example, Ayushman Bharat Digital Mission, which is a tested, tried and verified model, and it was launched long back, and now it is in the process of the implementation. So everything is going to be digitized in the health sector, and all stakeholders have to come on this platform together, so that all sorts of synergy we can get on a single platform. In this process, the pandemic has accelerated the adoption of the technology in the health sector. So very soon, I hope, very soon we will be able to implement this mission on ground through National Health Mission in all the states of India, and that will be a boon for, and it will provide equitable healthcare services irrespective of anything. Telemedicine is a good example of it. During the pandemic, telemedicine was more popular, and due to that telemedicine, patients are now less resistant, having their resistance to adaptability of technology has gone down. That is a good thing. So that is the point which I want to make over here.
Right, sir. So during your the entire tenure of which is I guess more than 2 decades, I guess 25, 27 years of service you have given to this particular sector, as an outcome or amalgamation of whatever special initiative which you have done, are you planning to come and share that information with us, and in what format, sir?
No, could you repeat? Actually, there was some. Could you repeat
जी
the question?
हीरालाल सर, व्हाट सो ये पूरा वर्क आपका जो रहा, ये जो जितना भी आपने शिद्दत से जो काम किया आपने लीडरशिप में, ये अगर हम आपसे कुछ सीखना चाहें तो आप किस फॉर्मेट में हमें वो देना चाहते हैं? आर यू प्लानिंग टू लॉन्च समथिंग व्हिच आई हैव हर्ड?
Actually, what you want to know, that is the Model Gaon. Actually, we are running a project Model Gaon, and that Model Gaon project is based on my experience and outcomes of more than 20 innovations done in the Mada. Because India lives in the villages, and Mahatma Gandhi wanted Republic village. He wanted to improve the condition of the villages. And our late missile man Dr. APJ Kalam Sahab started Pura. So the model Gaon is a tested, tried and verified model on the ground. It is a bottom-up approach which we are implementing on ground in the villages to realize the dream of Mahatma Gandhi and Dr. APJ Kalam. So we are practicing the theory given by our Mahatma Gandhi ji and Dr. APJ Kalam. It's easy to say in one sentence or two, but it is really very difficult because we need to change the mindset of the people to involve them. Because without involving the population or masses, nothing can be achieved, and even if it will be achieved, it will be not sustainable. To get a sustainable solution, we must involve the masses, contribution in different format and different forms of the masses, and everything should be done in the leadership of the masses. Administration should follow from the back. Leaders should be the masses. That is my style. One thing, in doing any work, generally people ask for, run for the money. I need budget and this, that, which you are not going to get from anywhere. So my style of functioning is the low cost or no cost. Whatever resources, input, idea you do have within the stakeholders, converge that, mix that to get done that your work. So that is my governance style. How to involve the masses, how to get done the work in the leadership of the masses, and how to minimize the cost, either no cost or low cost. So this is the basics of my governance style, and this is the sustainable style, and I use to get amazing results wherever I apply these criteria in my governance. For example, in Bada, I increased the water table by 1 meter, 34 centimeter in a season with the public participation. I increased the crop productivity around more than 18% with the public participation. So we reduced the malnutrition significantly with the involvement of the public masses, which is not found in governance style of the officials. That's why our governance is not going towards good governance.
Absolutely. Yes, thank you so much, Hiralal sir, for those inputs. With us now, we also have an eminent speaker and an immediately dynamic officer, a government officer, Dr. Kamal Yadav ji with us. Let me also invite his views and his presence also in this talk, sir. And with this, let me introduce Dr. Kamal Yadav ji. He's an IS and a district magistrate of Baghpat in the state of UP and a special secretary of AYUSH. He is a 2013 batch IS officer. He did his pharmacy education in his hometown, Sikohabad, near Allahabad, UP. 10th and 12th from UP Sainik School, Lucknow. He completed his graduation from Madras Veterinary College. He wanted to do something fruitful and effective for the betterment of the society and the nation. So he started preparation for the CSC. Mr. Yadav attributes his success to his parents and says that he has also always been inspired by his father, due to which he is known. He is now an IAS officer. Rajkamal Yadav ji hails from Firozabad in UP. He was born in Sekohabad, Firozabad district. His father, Kamal Kishore Yadav ji, worked in Grameen Bank. He's a and to know Dr. Rajkamal ji, he's also a very good player in cricket. Apart from this, he's also fond of bodybuilding. He sweats in the gym every morning for hours. Mr. Yadav started preparation of IS only during graduation. After coming to college, he used to study for hours, as many as other subjects related to general studies and civil services. He cracked the 2012 UPSC examination with an All India ranking 21. He was posted in the special secretary in the Secretariat Administration Department and whatnot. It's from my small mouth, sir. It is so much less to speak about you, Rajkamalji. And we acknowledge your inclination and interest in sports, in physical fitness, bodybuilding. It's really incredible, sir. Your followers and youth look at you as the role model. May I please invite your participation, and would you please like to highlight some of your special initiatives in your district, Dr. Rajkumar?
Thank you so much. At the outside, let me first congratulate everyone who is associated with this initiative. It's a wonderful initiative, and the topic is very apt for current scenario, which all of us are going through and feeling in the field. And as a healthcare professional, I can see a lot of hospitals and other at management positions are joining with us today. So, the kind of situation which we are facing, like if we can place ourselves in the time frame, we can understand. Like when we were kids, I think we were the only generation who would have seen when we used to go to doctor, there was still the time of giving tinctures in glass bottles. There was still time of giving, crushed tablets in form of pudiya, what we can, and then used to write, compounder used to write that आधा आज लेना है, आधा शाम को लेना है. So we were in the time which we have seen this, and at the same time we are also in the form of era of digital transformation, where we can see that we can get our prescription from good hospitals and good practices which are set up in NCR or other big places, where they can send you the properly legibly transcribed English versions of your prescription, and what to do, what not to do. Those terminologies which was very very coded and secretive, where only few people could decipher them. Those things have those stigmas has been broken down by the society. And after this pandemic of COVID, I think this is the time when everybody has to realize two different aspects of health, which is health and wellness. At most of the times we carry both these things together, health and wellness, but there's a starking difference, and one has to understand that. And I think entire health fraternity, all our health givers and all those who are practicing are understanding that. I would like to sum up my things in two different versions. Like I've done a good stint in AYUSH, which is mostly promoting and helping the wellness part, and the primary, of course, the primary healthcare part also. And the second thing is, which we are seeing in the field as an administrator, as a person whom somebody is looking for to come and to give solutions and to find solutions, or to create or to fill up that void which is happening in our service delivery. Keeping these two things in mind, I think government at both state and central level has come up with a very good concept under Ayushman Bharat, which is like Health Wellness Center. I am sure all of you must have heard it. And this Health Wellness Center is one such unique initiative which will actually help in bringing the wellness among the society and decrease the load on our healthcare professional. That is for sure. The time will be defining that whether we'll be able to achieve it in 1 year, 2 year, or it will take some time, because the concept of wellness is still very, very new in our society. Very, very new. Nobody's bothered. If you ask somebody that, okay, you're not sick, but still, do something like this, they are not going to listen to. They are not going to listen to anybody. I think at this point, we need our healthcare professionals to come and rope into this idea that if a thing comes from the mouth of a doctor, a person who is well recognized, who is well settled, who is well, serving in the society, people whom consider that, okay, whatever he says or whatever he, do for our curative measures, those things works. If these things will start coming from our healthcare professionals, then people will start realizing that, okay, wellness is something which is much more important than our health, or it comes first. those kind of concept and those kind of ideology has to generate from the society and from the industry itself. So that is one thing which I like to focus. I myself, and I want all my colleagues who are joined here and all healthcare professionals who are joined here to keep this thing in mind, because that is very helpful. Second thing is the curative part, which all of us are seeing. Like if you see the therapeutic and curative part of state of Uttar Pradesh, you will see that there are probably two parallel departments are running. One is like the health department, which NHM and our health ministry look after this, and then another parallel, a different version of healthcare is running in the name of AYUSH. The same like National Health Mission, there is a mission, National AYUSH Mission, which runs in our state. Let me just give you one very simple examination that the lowest, the bottom line in our healthcare industry is sub-center, which we have in our state. So on an average, every one village or every two village have a sub-center where we have our specialized ANMs, like the lowermost trained healthcare professional which we have. On the other side, if you see the AYUSH, we have the dispensary, which is also at the same level, working at the almost same level, like sub-center is equal to AYUSH dispensary.
Yeah.
But when you go and see the confidence which is having, like if you go on a AYUSH dispensary, you will find a person who is writing doctor so-and-so, so-and-so. His degrees are BAMS, BHMS, or BUMS. On the same side, parallelly, when you go to the sub-center, you will find an ANM who is a trained healthcare professional. So these two things are clearly managing the primary health at the ground level in our state. I think these people has to be tapped by the tertiary healthcare professionals who are either they are in government or they are in private sector, because unless we pass on the knowledge which we are acquiring directly from the industry, whether it is research, whether it is the modern practices, whether we are following any medical subscription, whether we are learning from our peers from here or abroad, unless we will train these guys at the field, we'll always be feeling the load on the tertiary healthcare system. That load is not going to get down unless these guys are getting trained in a much more better way. So keeping these two things in mind, I think from this forum, I will only request and I'll only expect that these two things of primary health and wellness should be kept in mind whenever we are reaching out to the society. Coming to the topic which we have today, I think socio-digital transformation, which we are looking at, there are many needs which are happening right now in the society. Like, I don't want to carry all my medical history in my bag and go to a doctor. Nobody wants to do that. Those days are over now. That I'm having 10 X-rays, 2 ultrasound reports, 5 medical prescriptions from 5 different doctors. Now the solution is a composite and a comprehensive record keeping across the healthcare industry at some consensus, which we all of us can sit down and make, where the data security is of prime importance. My data is not utilized for unusual bombarding of different things which I'm not in need of. I don't want to go on to that, but still the need is that my comprehensive health data should be with me in some digital format. So if I go to X hospital, Y hospital, Z hospital, I don't have to run along with my files. I don't have to run along with the expert opinions which I have, because there is a difference, a starking difference, which all of us can feel when two doctors are speaking among themselves, when a doctor is talking to a patient, and when two patients are speaking among themselves. These three different level of understanding, and these three different level of communications, they are having so much of variables that until and unless two doctors can come on the same plane, I don't think the person who is carrying their reports could be a true reflection of whatever condition he is suffering from. So I think the most important need of this hour is to have a comprehensive data set to be prescribed for each and every individual in any format, whatever we require for. Although, I totally agree and totally support this fact that data privacy is of the prime importance right now. But this thing is required and we all have to work upon this. Second thing, when we come on to the social digital transformation, I think there is lots and lots of material which is available on, if you start sneezing, you go onto the Google and you find yourself that you are suffering from the most gravest disease which is available in this world, you will come onto that conclusion, because there is so much of data and so much of information which it has been provided in a digital platforms. I think as a healthcare professional and as a person from administration, I think it is the combined responsibility of both of us that we have to advocate and we have to come up with some advocacy policy on this, that whatever data is posted or whatever data is there should be verified through certain mechanisms, because anybody who has earned or learned anything is trying to be a doctor, which is not the case. A person who has studied, a person who has gained experience, a person who can be trusted with the life of somebody else, these are the virtues which has been earned by very hard work, with dedication, with a lot of commitment. Just by seeing somebody that it has been cured by some medicine, that is not the way. So I think these are the flip side of the transformation which we are going through, and as an industry we have to come up with something towards this. This is what is going on in my mind. I will not take much of your time. If you have something for me to add on very specific, I will be more than happy to do that.
So that's great, sir. What a great start, in fact, from two stalwarts and the leaders who are who are doing the batting from the creech. On one side we have Dr. Kamal ji, the other side we have Dr. Heera ji. You have actually laid the foundation of the discussion for today's forum in a very apt way, sir. The way Heera ji started with the journey of his expertise, in the way he has given Banda as a role model, where other people who witness him as a role model could replicate the same format. Likewise, Rajkamal ji, I am so inspired, and by seeing you in such a young age, and still the kind of the adoption of physical fitness, health, sports, which the special initiatives which you have taken in that district, that has encouraged us. We should also, at least, if not maybe for 1 hour, for 15-20 minutes, we should definitely devote our time for our own physical fitness. So thank you so much, sir, for your opening remarks for this session. This has definitely given us a way to take this thread forward. And with this, let ArdorComm do one honors to kindly felicitate you and honor you for your exemplary contribution to the society, sir. We would like to present you an e-certificate. So let me present this e-certificate to Dr. Heera ji. Yeah, please show. This is a small token of thanks and appreciation. You being in such a senior IAS officer, and also handling a role of an additional mission director, second in command in NHM. And thank you so much for guiding us away, sir. I am sure that 15 minutes justice is not given to you. I'll be having a dedicated session with you as a fireside chat round in our leadership talk show. There I'll be trying to get more inputs from you over here.
Thank you.
As of now, thank you so much for this time, sir. Thank you so much. Next, please. Present this honors and certificate to Dr. Rajkamal Yadav ji, an IAS officer and District Magistrate, Baghpat, Government of UP. Thank you so much, Rajkamal sir, for joining us and guiding us with your initiatives which you have done in your sector. Definitely, it adds a value to the speakers who have just witnessed and the audience who have just witnessed. Thank you for joining us. Thank you.